Hello guys, so I thought I would do a video to give you an update on what's going on. So the last video I think that you saw was me just getting really excited about my surgery because I was going down from 2 stomas to 1 and it would be a lot easier to manage. And yeah, I originally went to my surgeon asking for an ileostomy and just to get rid of my colon, but he said there's a lot of benefits to trying to use the colon, and the last scope that I had through my stoma, through my colon, which was like a few years ago, everything was healthy. So he was like, we'll try this first. So he kind of convinced me to go through for a colostomy, so basically getting rid of my ileostomy and changing the mucus fistula that I had into a proper colostomy. So that was the plan. So I had the surgery on the 12th of May. And the surgery went really, really well. The join from the small bowel to the colon was like perfect. It was a really good join. The wound that I was really worried about, the incision wound, he stapled it, which is what I asked for, and that's healed so well. And the wound from the old stoma, that's healed really, really well as well. So that's really good. That's really positive. However, there's been a tiny, there's been a bit of a complication in the sense that since my colon was connected again and started working again and doing its thing, my Crohn's disease has come back and flared up massively. I mean, I've always had Crohn's disease, it's always been there, but it's flared up. The symptoms have been triggered, and it's purely because of it having stuff going through it again. Even in the surgery, he said that he couldn't see any evidence of Crohn's disease, but as soon as I started eating again and stuff was going through the colon, it just completely irritated it and inflamed it. And yeah, so I had an endoscopy yesterday, just to kind of through the stoma, along the colon and a little bit of the small bowel as well, just to kind of see exactly what was going on. Small bowel's fine. The join between the small bowel and the large bowel is still okay. There's still stitches there. I could see the stitches because I was on a lot of gas and air, but I didn't have sedation, so I was pretty alert and I could see what was going on. So like I say, the join is fine, but all the way through the colon is completely inflamed. Like I could see ulceration, I can see inflammation, and yeah, it just wasn't looking healthy at all. And I'd had a CT scan right after my surgery, and then again 2 weeks later. And between those 2 times, that's when the inflammation had come. So the first scan, there wasn't really that much, and the second scan there was. So it is totally after my surgery. So on the one hand, I'm kind of annoyed that the surgeon did convince me to use my colon, but he couldn't predict that. And even during the surgery, there was no evidence of Crohn's. It was only afterwards that it's all flared up again. But my gut instinct back then, when I was discussing all these options in the beginning, was always to get rid of the colon because I just didn't trust it. And I told him this and he was like, it'll be okay, it'll be okay. So he's very apologetic because he didn't expect it to A, happen so quickly, and B, be so, well, he just didn't expect it at all, which I don't think anyone did really. So at the minute I'm now on a higher dose of my azathioprine. I've gone up to 150 milligrams of azathioprine. I was originally on 50 milligrams. Now up to 150, and I'm currently back on prednisolone, which is a steroid, which sucks because I hate prednisolone. So I'm on 8 tablets of those at the minute. So yeah, so 40. It's stepping me down 10 milligrams a week. So usually I think they usually do it 5 milligrams a week. So you start off at 40, then you drop off to 35, then 30, then 25. But he's going to just drop me off 40, 30, 20, 10. I don't know why. He just decided that's what he was going to do. This was the gastroenterologist consultant rather than the surgeon. But he said, we're going to see how that goes. It could be that is enough to sort the Crohn's out and the colon will start functioning properly again and it'll be fine. If not, I can try biologics, so stuff like Humira or infliximab, which are either infusion or injection. Or I think there's one where it's like a pen as well. So there's that, and then if nothing works, like if azathioprine or biologics or anything like that just doesn't work at all, then the only option would be to go back in surgically and remove the colon and go back to an ileostomy. So I'd still have one stoma, but I'd have to go through the surgery again in order to get that one stoma. But in theory, that should be fine because I've not really had any problems with my small bowel. So in theory, you know, that would sort of solve this problem. So that's where we're at the minute. Today is my first dose of the steroids and the first dose of the higher azathioprine dosage as well. So we will see how that goes. But on the one hand, I'm really glad that surgically wise, it's all gone really well. And, you know, the scar is fantastic. And I mean, as fantastic as a scar can be, it's a lot better than it used to be. So on that side of things, I've been so happy because it's healed so well. But it could be that in 6 months' time I have to have another surgery, which I really hope I don't. I'm hoping that I can just treat it with medication, but I'm just really annoyed. So that's where we are at the minute. But I've had so many messages and tweets and emails and everything from so many people saying, you know, get well soon, I hope you feel better soon, and, you know, kind of following the journey, because I've kind of documented it a little bit on Facebook and Twitter, but I thought a video would help kind of explain where we are right now. So, but yeah, thank you so much for all the messages. It's been amazing. It's kept me going through, you know, I might not have replied to you, but it's definitely kind of kept me going and kept me positive. So I really appreciate it. Thank you so much. But yeah, so it's a case of just seeing how this Crohn's disease goes now. I did have an infection from something. They think it's because of the inflammation in the bowel. It's just had a knock-on effect on an infection. So I'm also on antibiotics at the minute as well. So like I'm pretty much rattling at the minute from how many pills I'm on. But yeah, it'll be worth it. I need to persist with all the medication I'm on. So it's rubbish. I mean, it could be worse, it could be better, but I'm trying to stay positive, and, you know, I'm stocking up on movies and, you know, watching Netflix and keeping myself entertained and busy. And in fact, one of the things I watched recently, which while I'm at, I might as well just tell you about how awesome it is. The Artist. If you've not seen this film, now bear in mind, okay, I think a certain amount of people probably wouldn't like this. Like my husband, Chris, he wouldn't like this because he doesn't like silent movies, but it's a silent movie, but made in, when was it, 2000 and something, 2010? Okay, it might have been later than that, 2012, I can't remember when this was done. It's basically a silent film, and it's shot using kind of like old methods as well, black and white, silent film, but it's got people like John Goodman in, it's got Jean Dujardin, who I can never say his name. He's the one that looks like Gene Kelly, the French actor that looks the spitting image of Gene Kelly. As you can see, it's unbelievable. I just absolutely loved it. It was happy, it was romantic, there was some really sad moments in it, there was really kind of moments where I was like, ah! In it. It's just such a good film. So if you like old-fashioned, black and white, romantic, funny, just watch it. It's so good. I know everyone's probably seen it already. I'm so late to the party with this, but if you haven't seen this, get it. It's so good. So yeah, so I've basically just been going through a list of movies that I've not watched for ages. So I've got on my list, I've got Definitely Maybe with Ryan Reynolds. I've done quite a few Ryan Reynolds films. I've already watched Van Wilder, and I've already watched Waiting. I'm trying to find my copy of Just Friends. I know I've got one somewhere. It's one of my favourites of his. But yeah, Definitely Maybe as well. Jerry Maguire, I mean, it's okay. Good Will Hunting. And then last night we watched Hot Fuzz, and the other day we watched Shaun of the Dead, and we will be also watching The World's End as well at some point, because that's my favourite. It's Chris's least favourite. He prefers Hot Fuzz. I prefer The World's End, but whatever. I'm rambling about movies now. You're clearly not interested. But anyway, I'm gonna go. So yeah, thank you again for all your messages, and I'll try and keep you updated as much as I can, either via Facebook or Twitter or YouTube. So yeah, I hope you're doing well, and I'll speak to you soon. Bye.